Record-breaking rainfall in Shenzhen forces authorities to hastily release floodwaters, Hong Kong in chaos. Fujian, nearly 600 reservoirs release floodwaters, disaster victims desperate for help. China reports 501 new monkeypox cases in August, first female cases reported. Violent demolitions in Fuzhou, villagers protesting, beaten and sent to hospital. ACP utilizes healthcare worker salary cuts to divert attention from more substantial corruption cases. It's all covered in today's China Truths. Record-breaking rainfall in Shenzhen forces authorities to hastily release floodwaters, Hong Kong in chaos. On September 7, Typhoon Hastily unleashed devastating rainstorms in the regions of Shenzhen and Hong Kong, leading to simultaneous and catastrophic floods in both areas. The Shenzhen Meteorological Observatory has reported that as of 2 p.m. on the 8th, the rainfall in Luohu-Xiaowutang over the past 72 hours reached 614.6 millimeters, breaking 7 historical extreme records in Shenzhen since meteorological records began in 1952. The heavy rainfall prompted authorities to make a hasty decision to release water from the Shenzhen reservoir around midnight on the 8th. Initially, the authorities stated that the discharge rate was only 80 cubic meters per second, and that it might not have a significant impact downstream. However, just 3 hours later, they issued an emergency notice that the discharge rate would increase to 120 cubic meters per second. Videos depict severe flooding at the exits of Shenzhen railway station, Luohu, with many passengers trapped inside along with their luggage. Floodwaters have inundated both the train station's interior and the adjacent subway station, turning staircases into cascading waterfalls. Apart from Shenzhen, Guangdong, including Zhuhai, Guangzhou, Foshan, Dongguan, and other areas, was also affected. Roads and tunnels were submerged, some sections were chest-deep in water, and firefighters were urgently evacuating trapped individuals. At 7:30 a.m., red rainstorm warnings continued to be in effect for 20 townships in Dongguan, with schools and extracurricular training institutions in some townships suspending classes. Online videos show flooding on roads in Foshan, with residents using benches to prop up their cars to prevent them from getting submerged. Heavy damage on Hong Kong, rainfall breaks 139-year record. Due to the Typhoon Hastily-S residual circulation impact, Hong Kong hits a century-level rainfall. On the evening of the 7th, the Hong Kong Observatory issued an emergency rainfall warning. Starting from 9:25 p.m., the warning escalated from yellow to red and eventually to black. Some areas received over 200 millimeters of rainfall, breaking a 139-year record in Hong Kong. Furthermore, on the evening of September 7th, the Hong Kong government alerted the public that the Shenzhen reservoir would commence flood releases at midnight on September 8th, with potential flooding in parts of the new territories. However, this notification from the Hong Kong Government Information Office was issued at a mere 23:44 on the 7th, a mere 16 minutes before the flood discharge from Shenzhen was set to begin. Consequently, residents had scant time to prepare or respond. As a result, transportation systems in Hong Kong were severely hampered, causing widespread disruption. The relentless downpour and subsequent flooding left Hong Kong's transportation infrastructure in a state of paralysis. The torrential rains culminated in a fierce deluge that inundated Hong Kong's streets, submerging vehicles and posing grave risks to pedestrians. Adding to the transportation woes, severe flooding affected MTR Wong Tai Sin Station and a segment of the tunnel, resulting in the suspension of operations at some stations. This unexpected inundation marked a rare occurrence for Hong Kong, with some attributing it to the flood discharge from Shenzhen. On September 8th, discussions related to Shenzhen flood discharge dominated Weibo's trending topics. Notably, images and videos shared by Hong Kong residents on social media platforms like Facebook and Twitter portrayed a calamitous scenario reminiscent of last month's flooding in Beijing, Tianjin, and Hebei, a situation that resulted from flood discharge efforts to safeguard the Xiulannu area. Hong Kong residents discontented over prioritizing Shenzhen over Hong Kong, resulting in increasing public outrage. Fujian, nearly 600 reservoirs release floodwaters, disaster victims desperate for help. In Fujian province, which had already suffered the ravages of Typhoon Haikui, the heavy rain has not relented. According to official reports from Fujian, on September 6, coastal areas in Longyan experienced heavy to very heavy rainfall, causing flooding in 11 rivers across 8 counties in the province, surpassing warning levels. Following this, since August 28, 598 reservoirs in Fujian have been opened to release floodwaters, leading to flooding in areas like Fuzhou, Fujian, and Quanzhou. Records indicate that 7 billion cubic meters of water have been discharged from Fujian's reservoirs since the 28th. Videos circulating online depict flood disasters in Quanzhou's urban area, with severe flooding affecting numerous townships across various counties. One resident shared that on the 6th, her house and a local reservoir developed cracks, and despite her frantic calls for help, there was no response, forcing her to evacuate her home. Additionally, videos show that nearly 9 reservoirs in Anxi County, Quanzhou, simultaneously opened their gates, resulting in breaches as the rushing water overwhelmed the reservoirs. When reporters attempted to contact several villages in Anxi County on the 8th, their calls went unanswered. Wang Jian, a villager working elsewhere, alias, disclosed that previous local flood disasters were deliberately caused by reservoir water releases, causing immense suffering to the residents. In the past, his family nearly drowned, and the reconstruction of houses was of poor quality, with disaster victims having to cover the costs themselves. When Typhoon Doksuri made landfall in Quanzhou on July 28, it also brought about disasters. Official reports indicate that nearly 1.45 million people were affected in areas including Fuzhou, Quanzhou, Zhangzhou, and Xiamen. Fujian residents have expressed their frustration, stating that over the past month, consecutive typhoons have wreaked havoc in the province, yet disaster victims have not received any assistance, leaving them disillusioned with the government. Mr. Lin, a Fujian resident, emphasized, "The situation is very severe, and many places in Fujian are affected. Mainland China is a dictatorship, and their care for people and the environment is lacking. Regardless of how many people are affected by flooding, the government doesn't seem to care, and there is no aid. We all envy those in Taiwan, the United States, Japan. You are fortunate. We are not as lucky." China reports 501 new monkeypox cases in August, first female cases reported. China is currently facing a period of unrest. In addition to the ongoing challenges posed by the new coronavirus, the country is contending with a succession of severe weather events, including heavy rainfall and floods. Moreover, there is a continuous rise in the number of individuals infected with the monkeypox virus. The Chinese Center for Disease Control and Prevention has reported that the number of monkeypox virus infections has exceeded 500 in the month of August. A vast majority, 98.9%, of the cases are among males, and 92.5% of them are explicitly linked to male-to-male sexual activity. Notably, official sources have, for the first time, disclosed 5 cases of female infection. These female cases all had a history of heterosexual contact within the 21 days preceding the onset of symptoms. Among them, 3 cases had partners who were monkeypox infection carriers, 1 case had recently experienced a rash, and 1 case exhibited no symptoms related to monkeypox. Presently, China lacks specific antiviral drugs for monkeypox, and the primary approach to treatment revolves around providing supportive care and addressing complications. Additionally, there is currently no specialized vaccine available for monkeypox. Violent demolitions in Fuzhou, villagers protesting, beaten and sent to hospital. On September 1, an appalling sight of around 500 individuals demolishing 2 village houses in Guizhou village, Jinan district, Fuzhou city, was captured. One of these dwellings belonged to Gao Hao, a resident of the village. The operation unfolded as the demolition team forcibly entered Gao Hao's residence and attempted to subdue him using long implements. Tensions escalated, prompting an outcry from a fellow villager situated upstairs. The situation deteriorated further when the demolition team resorted to deploying animal traps, ultimately pinning Gao Hao to the ground. Subsequently, dozens of individuals descended upon him, subjecting him to a relentless barrage of physical violence and leaving him injured and helpless. Later, an ambulance arrived, and medical personnel promptly attended to the injured individual, placing him in the vehicle. A villager named Mr. Zhao told the Epoch Times reporter on the 6th that a pervasive atmosphere of lawlessness had taken root in Jinan district. He remarked, Guizhou village is currently undergoing commercial development under the guise of shantytown reconstruction. There's a conspicuous absence of information disclosure and a glaring lack of government approval for demolition agreements. This entire situation is unlawful. We've reported it to the town government, but regrettably, no action has been taken, and no one has addressed our concerns. In another incident, Zhang Changjin, who resides at number 96-1, Hanli New Village in Guizhou village, was confronted with the impending demolition of her sizable 700 square meter home. This demolition was deemed illegal by the demolition office, led by a man named Suyong. On August 25, Suyong organized a demolition crew consisting of more than 200 people to dismantle Zhang's house. The demolition initiative in Guizhou village has been underway since late April. Shockingly, those villagers who had not consented to the demolition agreement found themselves subjected to forceful and illegal eviction in the name of government authority, with no formalities or court-issued demolition orders. The Observer decried the actions, asserting that such actions, allegedly orchestrated by the CCP, amounted to an unjust daylight coercion of common citizens. Wang Min, a long-standing resident of Guizhou village, vehemently expressed his outrage at the conduct of the government officials and staff involved in this demolition, characterizing it as a disregard for national laws, an abuse of power, and a callous indifference to people's well-being. He underscored his unwavering protest and fortified his commitment to defending his rights through legal means. CCP utilizes healthcare worker salary cuts to divert attention from more substantial corruption cases. The Chinese Communist Party has been actively pursuing its medical anti-corruption campaign for an extended period. In recent developments, numerous doctors and nurses within hospitals have experienced significant reductions in their salaries, leading to an outcry among medical personnel, who have turned to online platforms to voice their grievances. In detail, on September 1, a complaint surfaced on Sina Weibo, posted by the user Changsu Nirvana Rebirth, questioning the rationale behind the salary reductions at Beijing Tongren Hospital. The post questioned why the anti-corruption campaign resulted in a 50% cut in medical staff salaries, highlighting the grueling workload endured by these professionals, including countless night shifts, compensated at a mere 45 yuan per night. This complaint gained traction on the internet, prompting numerous doctors and nurses from Tongren Hospital in mainland China to share their concerns on social media platforms. However, their voices were short-lived, as most were swiftly silenced by government authorities, and the aforementioned posts on Sina Weibo were removed. On September 5, an Epoch Times reporter managed to contact Dr. Li from Tongren Hospital, who confirmed the reality of the salary cuts and the widespread dissatisfaction among healthcare workers due to their exceptionally low income levels. According to a report from EconomicObserver.com dated September 3, several doctors confided in the publication, revealing that Tongren Hospital had implemented a 50% reduction in performance bonuses and night shift fees. Previously, this doctor received approximately 15,000 yuan per month in performance-related income. However, following the salary reduction, they now receive around 7,000 yuan. Shanghai MedSci Medical Technology Company functions as a comprehensive online platform for medical professionals. In an article dated June 12, addressing the topic of salary reductions within hospitals, MedSci unveiled significant insights. It was disclosed that, in comparison to the total income earned by medical staff in prior years, the salary cuts ranged from approximately 15% to 35%. Furthermore, since the start of this year, over 65% of doctors have felt the impact of salary cuts, affecting not only their performance-related income but also encroaching upon their guaranteed basic salaries. Throughout this year, the CCP has intensified its medical anti-corruption campaign. August witnessed a frequent shuffling of officials within the healthcare system, with medical representatives disbanding their work groups and essentially taking a break at home. Academic conferences faced postponements, and certain hospitals urged pharmaceutical companies to terminate their relationships with medical representatives. Simultaneously, a wave of investigations ensnared hospital directors, secretaries, and corporate executives from pharmaceutical companies, with a continuous stream of news unfolding. According to Southern Metropolis Daily's data as of August 14, approximately 179 hospital principals had been subjected to investigations this year, more than double the figure from the previous year. Tang Jingyuan, a current affairs commentator, shared his insights during a September 6 interview, suggesting that the true motivation behind the medical anti-corruption campaign of the CCP is not necessarily a genuine commitment to rooting out corruption in the medical field. Instead, it appears to be a strategic response to economic challenges, driven by fiscal constraints within the party. This strategy involves diverting public attention by emphasizing anti-corruption measures. In doing so, the party aims to intentionally mislead the public into believing that the challenges of accessing medical care in China are primarily due to corruption among doctors who allegedly receive excessive kickbacks. The eventual consequence of this process is the overhaul of grassroots medical and nursing groups, inevitably resulting in a significant decline in the overall quality of healthcare services. Ultimately, the primary victims remain the vast population of patients. In essence, everyone bears the high cost, while the true beneficiaries continue to be the privileged classes within the CCP. Don't forget to comment in the section below to share your opinions on today's topic with us. Make sure to like and subscribe to see more interesting topics from China Truths.